Right, now it's 1 minute to. I'm going to hopefully welcome Helen Bevan, who I'm sure everyone in the room must know who Helen Bevan is. Do you all know Helen Bevan? An absolutely inspirational change leader who thinks outside the box. A very similar character to Pete, you've met earlier, who has some fantastic ideas for how we can make change in community services.
I'm really thrilled to join you virtually today, and what I want to talk a little bit about is some ideas for NHS Change Day, which is on Monday the 11th of March. And I want to talk to you a little bit about the background to Change Day and hopefully inspire you to want to take some action. So, you know, just something to think about to get us going. You know, too often in the NHS, people think that change comes from the top and it's rolled down. And yet, if you look at the history of change, you know, it's just not true. Okay, what history tells us is that change always starts on the fringe or at the edge, and it starts with the activists. So if we want to create some very big changes, you know, we want better care for our patients, we want better quality, we want to make better use of our resources, then really the best place for change to start is at the edge and with the people that do the work. So about 18 months ago, we did a learning review around change in the NHS, and this was right the way across the board. This was in primary care, community services, mental health, in hospital services, in ambulance services. And do you know what we found was, wherever we looked, exactly the same thing, which was that the biggest issue when it came to people making change in their own services was a sense that I don't have permission to make change. You know, I don't have permission to make even the smallest change. So, you know, this is one of the ideas behind NHS Change Day, that everybody has got permission to make change. And there's one day a year when all of us symbolically can make a change. And if we do this across the whole country, across the whole nation, then all those very small changes add up to a big change. So literally, this is the third year this year of running NHS Change Day. And it's a grassroots movement. And hundreds of thousands of people get involved in it. People who work in the service, patients, people who care for those in need, family members, volunteers, members of the public. And what we want to do is just focus on that one day, on the great changes that we're making in our health and care system. And obviously, you know, we want to be doing change and making things better the whole year round. But by having a focus on that one day, it makes a real difference. And when we've evaluated it, what it's shown is that for over 80% of people, you know, the changes that they've made haven't just been for one day, they've been all year round. And if all of us can make a small change on that day, we can make very big things happen. So how it works, like anybody can make a change. And there's a whole series of organised campaigns that are going on. So there's campaigns supporting people living well with dementia. There's a campaign, obviously the very famous Kate Granger campaign around My Name Is. There's a campaign around people getting together for paired learning, where clinicians and managers make different kinds of connections with each other for the good of patients. But anybody can make any change they want. And what we do is, you know, we focus on that one day. So this is our third year, and what are we doing slightly differently this year? So in 2013 and 2014, we asked people to pledge. This year, we're doing something slightly different. What we're asking people to do is to actually start a change and tell us about it. So, you know, rather than just do a pledge, although a pledge is a great thing, and we like pledges, it's having started the change. This is the first immediate thing that we're doing. Like, what's the first step towards this change on this day? Now, many colleagues who work in community services, who work in primary care and in specific practices, have shared their stories to inspire others. So what I want to do now is just show you some of the pledges that I think and actions that are relevant that might inspire you. So the first one here comes from the Children's Asthma Service in Haywood, Middleton and Rochdale. And what happened here is that the colleagues from the children's community team, they started a Facebook page because obviously in terms of many of the young people they work with, then Facebook is their medium of choice. So they've been using this Facebook page to deliver asthma advice and some and as it says here, some gentle reminders. There's many examples of great change going on. So just think about this. Think about in the context of your service where you work. What are the things that you could be doing that's the equivalent of this? It should be on a slide, which is about Melissa Canavan of Lincoln Green Medical Centre in Leeds and practice nurse Sarah Anderson. So they set up as part of Change Day the Leeds Respiratory Network to improve the quality of respiratory care across Leeds. I mean, it was a phenomenal thing to do. If I could have the next slide. This is interesting. This is about continence pads for a day. And I put this one in. So this was the team that worked with older people at University Hospitals Leicester. They wore continence pads for a day to really kind of stand in the shoes of their patients. And putting this kind of, how do you put this discreetly? They wore the pads for 11 hours and they did what somebody would do who wore a continence pad to get a real sense of how it truly feels, to use them to be able to empathise with their patients. Many colleagues for Change Day will stand in the shoes or wear the clothes or of some other way of experiencing the patient. So lots of people will use wheelchairs for a day. We've had colleagues who've used bodyboards, but just finding ways to stand in the shoes. If we go on to slide 12, again, Dementia Friend has been very popular, and I think this is probably one of the best examples. Andy Tyso, who is a clinical specialist nurse for people living well with dementia. He was sparked by Change Day, and by this December, he's delivered over 100 Dementia Friends training sessions to over 3,000 people. And Andy is one of the leaders of the national campaign around people living well with dementia for Change Day 2015. If I could have the next one. This one here is about dementia-friendly paint, and okay, it's in a hospital setting, but it's something that we could do so easily in different places. And again, this was the painter and decorator in this hospital, Rob McGuinney, and he basically said we should paint our facilities in dementia-friendly colours. And so now this whole organisation only uses dementia-friendly paint. And again, that's another initiative that came out of Change Day. This example here is a mental health support worker in Dorset Healthcare who set up a boxing club. And, it was a boxing club for, literally anybody that wants to use it. So people that are using in this mental health trust, people that are in an inpatient setting or using ambulatory care, staff, family members, everybody can use this boxing club. So this says, what can I do? And, the first thing is be inspired by other people. So if you go onto the website, and I've put the example there, there's 100 days of change. And what this is about, every day is a different different story of people, not asking for permission, but getting on and making change. Then the second thing is about making a change. So yes, today, pledge for what you want to do. And then when you've taken your first step towards that, you don't have to actually make the change, but just take the first step towards it. And tell us about it and record your action, and it will inspire other people. One of the things I'd say is don't be overambitious. And a really great thing to think about is to move 2 steps down. So if you want to make a change that might take a year, what could you do in a week? if you want to take a change that would normally take you months to set up, what could you do in a couple of days? So, always move 2 steps down and start the change and build back up. I think it's a very helpful way of doing things. So I hope that, during the rest of this change hour, that you'll come up with your own ideas, and there may be things that you're doing already that you could build on, or new things that you'd really like to do, or maybe find some other people that are at the conference with you today who might want to do something collaboratively with you. But I mean, there's so many opportunities, I think, for us to make change happen. So if I could have the next slide, it says 50 reasons not to change. Sometimes I think it's very, very difficult to make change happen because we feel like we need permission, or we feel like other people are going to reject the changes that we want to make. So, I think we need to, as agents of change, sometimes we need to think differently. And instead of saying, well, everybody's going to say no, we can't do that because we tried it before in our practice in 1978 and it didn't work, or the trust board won't like it, or it's against policy, or we haven't got the equipment. There's so many reasons why our ideas get rejected, and we say no, 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 no. So just something to think about. If you've got an idea for a really great change that would make a difference to a lot of patients or families or the community, or would help colleagues, and you're worried that your idea is going to be rejected or somebody's going to say no, I want to suggest a different way for thinking about no. So if I could have the next slide that says key number 1, okay? So have you got it? Yeah. Instead of avoiding rejection and worrying that someone's going to say no, actually, why not increase the number of no's that you get? Okay, and it's called go for no. And if I could have the next slide that says key number 2. The thing is that whenever people reject our ideas for change, they're not rejecting us personally. What they're doing is rejecting this idea at this point in time. So if we go for no, instead of taking it personally, we can say, great, another no. And if I could have the next slide, it says key number 3. So instead of feeling badly about being rejected, or my idea not being taken up, or somebody saying no, let's respond positively. So instead of saying I'm too anxious, or I don't want to be rejected again, great, I've got another no. It's amazing. So if we go on to the next slide, number 4. So let's see key number 4, people saying no as an opportunity, and let's value it. So instead of saying, oh, I never want to hear a no again, say, oh, go for no. Let's have some more. In fact, if we can have key number 5, the next slide, why don't we make it a personal performance target to say, how many no's should I try for this week? Because the reality is, every one of us, when we're trying to make change happen, even a small change, we're challenging the status quo. And, I think that's a very difficult thing for other people sometimes. So if I could have the next slide, which says key number 6. You see, if somebody says no to us now, or rejects our idea for change, or tries to stop us doing it, the fact they're saying no now doesn't mean never. And no now may mean a very big yes at some point in the future. So when I think back to my own career, one of the things that I set up was the Productive series. Do you remember Productive Community Services, Productive Wards, Productive General Practice? And from when me and my team first had that idea of running the Productives, it took us about 18 months before it was accepted seriously. But we got no so many times. No, you can't do that. It's not in the business plan. No, you can't do that. It's not a priority. But eventually we could do it. And I think it's as a program, it's made a really big difference across the system. And let's look at some evidence around this. Okay. So when you think about trying to sell our ideas or get our ideas across, what industry can we learn from? Actually, we can learn a lot from the sales industry. So if I could have the next slide, it says research from the sales industry. you know, if you look at the evidence around selling, what it tells us is that only 2% of sales are made on the first contact, and 80% of sales are made on the 5th to the 12th contact. So it's going to take a lot of contacts, you know, a lot of talking about before we get people to accept our change. So I think sometimes we have to think about how can we make the 4th to the 11th attempt happen quickly and get through our nose so that we can get a yes by the by the 5th to the 12th time. So, you know, in terms of the ideas that you've got around making some change happen, however kind of nervous you are or thinking, well, people might not like that, you know, bring it on and go for no. So if I could have the last slide. Thank you for bearing with me with our slight technical difficulties, but I think that we've got there. And you know what I'd say is, please spend some time now, you know, thinking about your pledges, thinking about the next immediate steps that you might make with regard to change. But you know, please come and be part of this fantastic movement for Change Day, and do your one small thing that when we add it to all the other small things that people are doing across the country, it makes an amazing difference for our patients. And really happy to take questions. Thank you.
Thank you. Thank you very much, Helen. That fits beautifully with what we're trying to achieve today, which is how do we all get together collectively through our own willpower and our own resources to make a significant difference that's bottom up rather than top down. So, questions for Helen? Lady at the front. Say who you are as well. Thank you.
Hello there. I'm Eleanor Levy. I'm the chair of the London Clinical Senate's Patient and Public Voice Advisory Group and a representative, a lay member of the Pan-London End of Life Care Alliance. And your speech was very interesting, and I liked a lot of it, but this is about the third or fourth time today that I've heard a commercial model being used to justify an approach that we should be adopting for other reasons. Mainly, if it makes safety, patient and carer safety and health better, that's a good enough justification. If it makes services more efficient and more effective, that doesn't have to have a profit, a sales, a commercial application. The reason why sales are made on the 5th to 12th attempt rather on the first attempt is, in general, people in this society are selling us things we don't need, okay? If you want to take the commercial model to its full extent, then you end up with large chunks of the world owing unsustainable debt to other large chunks of the world. So let's do things because they're right to do. They make sense from a health perspective. Patients, clients as I call them, tend to do things that are unhealthy because of pressures that are social or psychological, and we need to be supporting our clients and ourselves to make these changes because it will improve well-being and quality of life, not because it makes sense in some kind of notional commercial model.
Helen? Thank you, Ellen.
Okay, that's a great provocation, and I'm really happy to answer that. So, you know, one thing I'd say is that, like, all models are wrong and some of them are useful. And I think that applies to this model. And I'd say, you know, when you look at where we are with regard to change in the NHS, I think we have to take models or theories from all over the place. And I could have given you a different example then, rather than from the sales industry. I mean, another example I could have given you was around scientists who are developing new theories. And what the research shows there is that when the new research scientists are developing new theories that really challenge the status quo. That very often they try to get their new work published, but because it gets peer reviewed by people who have got a vested interest in the existing system, then very often this new research thinking that's very challenging gets a no, it gets rejected, it doesn't get published. But then what these researchers did was looked at what happened later on, and what they found that those research papers that tended to be rejected early on because they were challenging the status quo were the ones that were most read later. So, the research papers that got the highest chance of rejection, the highest chance of being said no to, were the ones that were most read later on. So, I think we can take examples from many different industries and perspectives, and I like that sales model, not because it's commercial, but because I think it makes an important point. And I know, as somebody who spends all my life thinking about change, I mean, I constantly get rejected, and I think we can learn greatly from others, and I think actually we can take a lot of models and ideas around influencing, around getting people to change from other sectors. But the important thing is that we bring them back to our sector and we use them in a way that works for us and our colleagues and our patients. So I think there's. I think if we didn't ever use models because they were commercial, our change wouldn't happen very fast. So I use that model because it's about influencing people, and in a sense we are selling ideas as well, not because it's commercial. But we all have to find models that we like and that we're comfortable with, and I like that one. Good,
thank you, Helen. Okay, do we have any other questions? We've got a lady at the front.
Yeah.
Hi Helen, my name's Jenny Finch and I'm the Nursing and OD Manager at Islington CCG. I just wanted to ask a question about the Go for No idea, which was really interesting.
Yeah.
It was more to do with the fact that if you want to try and implement change and you come up with an idea and the response has been no so many times, do you not think that you also have to question why that is? So is it that actually the idea isn't a good idea and you need to address perhaps another idea would be useful? Or is it that there's a barrier for implementing change, and how you go about addressing those barriers?
Yeah, great, Jenny, thank you. That's a really great question. I'd say yes to all of the above. That I think that's why I really like this idea that saying no is actually, or people saying no is a valuable opportunity, because we're getting feedback on our ideas and whether they're gonna work or not. And we have to decide whether it's worth persevering with the idea, whether the circumstances are such it's never going to happen, how we can change the idea, who else that we can get on board. But if we think it's a good idea, I think that we have to persevere and find other people that we can connect with. There's a Cherokee saying, and it says, "If your horse dies, get off it." And I think often in these sort of situations we've got to decide, is it worth persevering or isn't it? But I'd also say that if we gave up every time somebody said no, we wouldn't have the NHS as it is. So it's a question of all the things that you said, Jenny, and working that out, but also persevering.
Time for one more question. Heather at the front. Okay. Yep.
Hi Helen, it's Heather Henry, NHS Alliance. I'm thinking about the Go for No with residents and patients and how we might encourage that. The example I give is when I was talking to a mother, and she screwed up all her courage and she said to me, "I want to start a baby massage group." in Salford. And I said, why do you want to do that? There's one at the Children's Centre. And she said, that's all very well, but mothers don't want to go there because every time they go, they feel judged. And the point I want to make is that in severely disadvantaged communities, our residents are starting to feel judged. And that our solutions aren't their solutions. How do we encourage those residents who had screwed up all her courage to ask me about that? And the reason she wanted to was because she felt that she was an appropriate person to talk to, and she didn't feel, I'm afraid, that the local health visitors were, and she felt that she could support her own peer group to access the services that they weren't. So I'm trying to make a rather serious point here. This is happening now in our communities, and Richard Wilkinson, Emeritus Professor of Epidemiology, you probably know this, Helen, calls it social evaluative threat. Some of our residents feel judged by us, and I think that we should encourage the go for no with them and listen to them very carefully. Thank you.
Yeah, fantastic. And I think, one of the, I absolutely get the important point that you're making there. And I think that, one of the great things that colleagues might want to do around Change Day is to have different kinds of conversations, or to spend time, in the shoes or with residents and families and patients to kind of, see the world from, or as much as we can, from where they see it, rather than make assumptions from where we see things. And I think that's in the context of Change Day, I think that's one of the most powerful things that people do, to actually have permission to spend some time doing different kinds of things that that really enable us to make a difference, and to stand in other shoes, and understand where people are coming from, and why, and create a different kind of dialogue and conversation.
Thank you very much, Helen, and for all of the colleagues who've raised questions, because I think it's helped to really broaden out how we think about the challenge you've posed us all. So, Helen, we're going to go away now, and people are going to start thinking about their pledges, etc. So can I say on behalf of everyone in London, thank you very, very much, and it was very much appreciated.
Right, I think you know what you've got to do now. It's been hinted at, Helen and Caroline have mentioned it, but we want you to make your pledges related to what you're going to do when you go back to work, and the changes you're going to make in the spirit of improving and changing community services. On your tables, you've got some very larger than I've ever seen before, post-it notes. There should be enough for one each. You've also got in your packs a change, what are we calling it? A change planning tool, okay? So we want you to think about three things as you're thinking about your change. What do you want to change? What do you feel strongly about? What's been niggling away, or what have you got a burning desire to do differently? Who do you need to engage to make that change happen? It may be for that first no. It may be something that you're not going to get a no, and you'll be okay to carry on. But also, what do you need to ask from people in order to make that change? So have a think individually, talk with your neighbours, come up with something that you can use the planning tool to think about what you're going to do. And when you've got that idea, it goes on the massive post-it notes, which we want to be stuck up on the change wall.